Hi there, my name is Matt Vigliotti, and this is my presentation for Nursing 2512. I've decided to focus on rural nursing in Canada. Growing up in a rural community, my family has had first-hand experiences with the challenges associated with obtaining adequate health care in rural Canada, so this topic hits close to home for me. Taking a look at the contents of the presentation, I'll begin with some statistics that will help frame the issues of rural nursing. Then I'll look at understanding the issue from a historical point of view, a political point of view, and an economical point of view. There'll then be a short video, and then I will go over some of my experiences with the rural nursing in Canada. I'll then follow it up with some challenges and some possible resolutions. To help frame the issue, we're going to look at a few statistics of rural nursing in Canada. Rural Canadians are considered a vulnerable group because they lack access to health services and overall have poorer health outcomes. 21 to 30% of Canadians are living in rural communities. There is a shortage of healthcare providers who are able and willing to work in rural and remote communities. Rural most often is defined as a community of fewer than 10,000 people. Fewer than 18% of Canadian nurses were working in rural communities in 2001. In 2000, 399 communities across Canada had a nurse as the only healthcare provider. Some of the major barriers for rural nursing in Canada include weather, mountain ranges, coastal hazards, large distances, and lack of resources. To help us understand the issue, let's start with a definition. What do we mean by rural nursing? Rural nursing can include public health nursing, home care nursing, or nursing in rural communities and geographically isolated small towns. Sometimes a nurse is the only healthcare provider in an outpost setting for those who have little or no access to medical care. Rural nurses are expert generalists who demonstrate an increased sense of responsibility for and commitment to addressing the health needs of people in their community. There is ongoing debate on whether rural nursing is a specialty or if it should require advanced practice or nurse practitioner competencies. Rural nurses have reported feeling marginalization or a lack of understanding about rural nursing issues from those who work in urban settings. So what is it like to be a rural nurse? Rural nurses require a wide range of knowledge and skills with minimal support and/or few resources. They work as both non-professionals, such as housekeepers and dietary aides, and other professionals, such as physiotherapists, pharmacists, and so on. They need to know who lives in their community, what their skills are, and whether they're available to address local health needs and respond to emergency situations. However, it is rewarding work. They're proud of what they do. They feel a sense of responsibility and commitment. This quote from Jane Ellis Scharf, I think, really explains well what it means to be a rural nurse. Being rural means being a long way from anywhere and pretty close to nowhere. Being rural means being independent or perhaps just being alone. Being a rural nurse means that when a nurse saves a life, everyone in town recognizes that she or he was there, and that when a nurse loses a life, everyone in town recognizes that she or he was there. Being rural means turning inward for answers, because there may be nobody to turn to outward. Being rural means that when a nurse walks into the emergency room, it may be her or his spouse or child who needs a nurse, and at that moment, being a nurse takes priority over being anyone else. Being rural means being able to deal with what she or he has got, where she or he is, and being able to live with the consequences. Now let's take a brief look at the history of rural nursing in Canada. The Victoria Order of Nursing was founded in 1897 by the National Council of Women of Canada. They believed that a lack of medical and nursing services contributed to high maternal and infant mortality rates. They began providing pre- and postnatal care across Ontario and established training homes which provided opportunities to take formal courses in public health nursing. The first rural public health nurses were often generalists. They provided health education, dental health, communicable disease control, pre- and postnatal care, prevention of chronic illness, and medical surgical nursing. They even provided veterinary assistance when professionals were not available. They knew that if they left their post, no one was going to take their place. Many communities could neither afford nor attract a physician. Therefore, outpost nursing began in the 1890s and was well established by the 1920s. Nurses were on call 24 hours per day to provide advice and treatment. Maternity care was the primary motivator for establishing outposts, but posed a problem because midwifery was legally restricted to physicians. Now let's take a very brief look at the politics surrounding rural nursing. In 2006, British Columbia removed management of normal labor from the scope of practice for registered nurses. Now, certification is required, regardless of previous experience. Some rural nurses had been doing this for decades. Nurse practitioners are being trained to provide primary health care services so that interprofessional teams might work collaboratively in rural and remote communities. However, as the list of required certification grows, how will the generalist rural nurses be able to perform their duties? Now let's take a look at some economical issues surrounding rural nursing. In the 1990s, there was significantly reduced federal spending on healthcare. Healthcare became centralized, and specialized areas were cut from funding. This increased costs for rural communities, for travel, emotional, social, and family costs of leaving home. Since 2000, 17 maternity services closed in British Columbia, with similar trends in Ontario and Nova Scotia. Is maternity care a specialized or a primary healthcare service? Issues of weather, travel, and geography resulted in higher travel costs and the need for seasonal adjustments in timing of home care visits. Understanding the issues surrounding social and cultural understanding in rural nursing. Registered nurses make an important contribution to Aboriginal health services in many remote and rural First Nations and Inuit communities. Since not all RNs working with these communities are First Nations or Inuit people, rural nurses need to be culturally competent and aware of the need to practice cultural safety. Rural nurses also need to be prepared for working in a politically charged organizational environment. Now I'd like to incorporate a short video that I feel really describes well what it means to be a rural nurse in Canada.
Then there's a chance to practice in areas of care that are special to the Yukon, such as working in an expanded role in one of the territory's 14 rural communities. Today, it's not the isolated posting it once was, but the challenges and rewards remain the same.
Nowadays we have computer with 24-hour access, high-speed internet. We used to put a note up in the nursing station door saying where we were, gone berry picking or out for a walk in the community or something, and somebody have to come and find us.
But it's changed now. There's 2 nurses in every community except for 2 of them in the Yukon. There's full-time clerks.
I wanted to try outpost nursing, and I moved up in 1997, and I absolutely love it. Probably because it gave me the opportunity to incorporate all the things I've learned over the years in nursing and to be able to put it to practice and be able to operate the full scope of what I can do.
I've thought about being a nurse practitioner for a long time. I like the autonomy that comes along with it. I wanted to have a little bit more say in what I did, a little more freedom to paint my own palette.
We not only do all our own health assessments, we diagnose problems, we prescribe medication, and we suture wounds up. We take x-rays. We're also our own pharmacists, so we dispense our own medications. There's been a few times called where I've had to go out and do rescues on the land, so I've got to take the nursing station snowmobile and go out into an accident site. And there's no way in a hospital would I be able to jump on the snow machine and go deliver care on site 60 miles away.
I enjoy knowing the people that I work with, knowing that when this elder comes in, I know their background, I know their history, I know what's going on in their family. It's also about working with the community, like working with the First Nation wellness worker and the director of health and social programs. Old Crow's got some real nice charm. The people are very welcoming. There's lots of activities to do. Not only were we invited to things like dinners and dances and community events, it was it's sort of an unspoken expectation that the people like to see us involved, and that's a very nice expectation, to be welcome. People are very respectful of our time. In Old Crow, they know that when the nurse is out in the community or after hours, that's our time for ourselves. So we usually get phone calls after hours for emergencies, and it's expected, and that's part of my job, but usually the first thing that comes out of people's mouth is, "I'm so sorry, but," or, you know, "This time I really need your help."
As far as supports in the Yukon for community nursing, it's better than anything I've ever had. Here you have a spring and a fall conference. The room, the accommodations, the meals, the travel, your wages are all paid. Since I came to the communities, I have worked with absolutely the best nurses I've ever met. They're people that are mature. Doesn't mean they're old, but they're mature, and have been able to incorporate their personal practice and their professional practice. And it's really a joy to see people the way they grow.
I believe that video provides an excellent segue into the part of the presentation where I talk about my own experience with rural nursing, or perhaps more accurately, my family's experience. I grew up in the small town of Dawson City, Yukon, approximately 6 hours drive north of Whitehorse. Dawson City was a booming mining town during the Klondike Gold Rush, with a population of over 40,000 people. Today, the population sits at around 1,250 people, although Dawson was allowed to retain its title of city. There is no Tim Hortons, no McDonald's, no Walmart. The only name recognizable to the average urbanite would be the one CIBC bank. While the most common wildlife a city dweller might see are squirrels, birds, and the occasional raccoon, the common wildlife in Dawson is significantly different. And this is the Dawson City Medical Clinic. As far as rural communities go, Dawson is fairly well staffed. There are 2 physicians, 4 nurse practitioners, 1 public health nurse, and 1 home care nurse. Specialty care, however, is much harder to come by. There is an X-ray machine, but no X-ray technician, so the physician is often required for setup. The closest radiologist is in Vancouver. The local lab is capable of providing a few basic blood tests, but the majority of these tests are performed in Whitehorse. Because of limited local diagnostic testing, physicians must be comfortable relying on their clinical skills. Any problem requiring a surgeon, obstetrician, gynecologist, or a psychiatrist requires a trip to Whitehorse. If a medevac is necessary, buckle up for the 6-hour, 550-kilometer trip to Whitehorse. A couple of times per year, specialists from Vancouver fly up to Dawson to hold clinics for areas such as orthopedics, ENT, neurology, oncology, and so on. I experienced this lack of healthcare staffing firsthand when my brother injured his hand and required surgery. He had been working on a construction project and was using a bandsaw when his hand slipped and came into contact with the blade, severing the tendons in the palm of his right hand. While losing a significant amount of blood, he stumbled to the medical clinic. Fortunately, since Dawson is such a small town, this was just down the street. He was seen by one of the nurses on duty who bound the wound, but informed him that both physicians were unavailable. but he could be medevaced to Whitehorse. So off he went on the long drive to the city with his hand bound and only simple analgesics for the pain. When he arrived at the hospital in Whitehorse, and after a wait of several more hours, he was informed that the surgeon on staff was not able to perform the type of surgery that was required, and that the closest specialist was in Vancouver. But he had to find his own way there. So my poor brother, dizzy from blood loss, took a taxi to the airport, purchased a ticket, and boarded the plane to Vancouver. When he arrived at his destination, he was in so much pain and had lost so much blood that he became disoriented, laid down in a corner, and lost consciousness. After a couple of hours, a man stopped to check on him and realized he was in trouble. After rousing my brother enough to hear his story, the man drove my brother to the hospital. The next thing my brother remembered was waking up after his surgery. Unfortunately, he never regained function of his 3 middle fingers and has only limited function of his little finger and thumb. He also lost all feeling in his hand. We'll never know whether or not the result would have been different had there been adequate staffing at either the Dawson or Whitehorse Hospital. But the hardships that my brother had to endure to get the help he needed should not happen to anyone. Now I'd like to take a minute to look at some of the challenges faced by rural nurses in Canada. Rural nurses have reported feeling a lack of recognition of the variability and complexity of their work, a lack of resources, including staff, urban-centric policies and guidelines, as well as educational programs, being visible in the community and feeling responsible for needed health services, difficulty working together when conflict is experienced in interprofessional relationships, and most RNs who leave their rural community for work or school do not return home. So what should we do about some of these challenges? Let's take a quick look at some suggested resolutions. These resolutions include developing recruitment and retention strategies, providing accommodation and support for students, scholarships and bursaries, listening to the voices of rural nurses, developing rural nursing learning opportunities for students, develop policies that reflect the realities of rural nursing, and provide opportunities for relationship building and interprofessional education. As you can see, there are many issues surrounding rural nursing in Canada, and much is needed to correct them. What happened to my brother should not happen to anyone, but unfortunately, it's not altogether surprising given the remote location of Dawson City. I hope his experience has helped emphasize some of the issues that rural communities can experience due to a lack of nurses and other healthcare professionals. I would like to thank you for taking the time to listen to my presentation today, and I hope you found it informative and entertaining. Have a great day.